This clip is sponsored by Med Travelers. If you're an SLP interested in travel therapy, visit medtravelers.com to get started. All right, so now once you've got your assessment, and again, I know this is not cut and dry by any means that this always, but what would be a typical process? You've figured out the device that's most appropriate. How do you begin planning treatment? What does that look like?
Treatment usually is just I almost see it as an extension of your trial period, because once you get a trial device and you work through your trial, you've already kind of started your treatment, where you are really trying to just implement that device into everything that student is doing throughout their day. So treatment, again, is just an extension of what are they doing? What do they want? What are they wanting to talk about? What are they wanting to tell you? Like, are they wanting to tell you to go away or leave me alone, or, and just kind of following along with the student. And really, I just immerse myself in their classroom, in their day. And if they will allow me to, I will model on their device. If they don't allow me to, I would have an iPad or something that had a mirror image of their device, of their page setup. So it would be identical to their page setup so that I could model on my talker. Because I've had some students that are extremely possessive and they are like, nope, this is mine. You will not touch it. And I honor that. And so then I model either on our school-based core board, or I model if I happen to have an extra iPad that has their same app on it, I will model on that. But treatment is it's a lot of just language treatment, just with your AAC being another modality. So you do a lot of the same things, but also wanting it to be if you're working on those initial emerging communication goals, you're really going to want to make it motivating for the kid. Again, so they're not thinking that it's a test or it's a hunt and find for a certain word. You're just showing them how if they wanted to talk about this environment that they're in, if it's too noisy or what have you, this is a way you could do it. I think you have your hands over your ears. I think you think it's too loud. And then you could just model too loud or noisy, or you want to make it stop, and you could just model stop. So you're just kind of thinking outside, like verbalizing what you think that they might be thinking, if that makes sense.
No, it makes perfect sense.
To try and give them the verbal words for it, but then also show them how they could use their device to express themselves as well.